How to avoid ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants in a location outside of the uterus, most commonly in one of the fallopian tubes. This kind of pregnancy cannot proceed normally, and can cause serious complications if left untreated for too long. There is not much you can do to avoid having an ectopic pregnancy, but there are a few ways to reduce your risk factors. Reducing your risk factors. Step 1. Reduce your risk of sexually transmitted infections. Sexually transmitted infections, STIs, such as gonorrhea or chlamydia, may increase a woman's chances of having an ectopic pregnancy. Limit your number of sexual partners in order to reduce your risk of exposure. Always use a condom during sex to reduce your risk of contracting a disease. Step 2. Get quick treatment for infections. If you do get an STI, it's important to get treatment right away. The sooner you are treated, the less likely you are to develop inflammation that may damage your reproductive system and increase your risk of developing ectopic pregnancies. Common symptoms of STIs include abdominal pain, painful urination, vaginal discharge, abnormal vaginal bleeding, vaginal odor, and pain during sex. Step 3. Quit smoking. Smoking may increase your risk of having an ectopic pregnancy. Quit smoking before you try to conceive in order to reduce your risk. The more you smoke, the higher your risk of having an ectopic pregnancy will be, so if you can quit, even reducing the number of cigarettes you smoke may be beneficial. Step 4. Understand the other risk factors. There are many other factors that may put you at a higher than average risk for developing an ectopic pregnancy. If any of the following risk factors apply to you, it is especially important that you see a doctor as soon as you have reason to believe you are pregnant. Women who have had a previous ectopic pregnancy. Women who have structural abnormalities of the fallopian tube. Women who have struggled with fertility problems, especially women treated with assisted reproduction technologies, IVF, ART, etc. Reducing your risk of complications and future ectopic pregnancies. Step 1. Get treatment for symptoms of an ectopic pregnancy. It's important to get medical treatment for an ectopic pregnancy right away. The sooner you get treatment, the lower your risks will be of developing severe complications. Common symptoms of an ectopic pregnancy include missing periods, pain in the low back and abdomen, can be on the right or left side, cramping, abnormal vaginal bleeding. Step 2. Opt for medicine instead of surgery if possible. If you develop an ectopic pregnancy, you will need to either take medication or have surgery to remove the pregnancy. If medication is an option for you, it may be preferable, as it is less likely to cause damage to the fallopian tubes, which can further increase your risk of having another ectopic pregnancy in the future. Step 3. Report persistent abdominal pain. If you have abdominal pain that does not subside after you are treated for an ectopic pregnancy, tell your doctor about it right away. This may be a sign of an infection, which could continue to increase your risk of having ectopic pregnancies if it is not treated. Step 4. Have future pregnancies monitored early. If you have had an ectopic pregnancy in the past, you should see your doctor for blood tests and ultrasounds as soon as you think you are pregnant again. This can help confirm early on whether your pregnancy is normal. Most women who have ectopic pregnancies go on to have normal pregnancies, so don't give up hope. Thank you.